Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Good morning, good afternoon, good evening, whatever time of the day you're listening to me. I am happy to welcome you to this fresh episode of ATP Hour. Special welcome to those of you who are watching me live on Ask the Pediatrician Facebook groups or our YouTube channel. Thank you so much for being with us. And also thanks to those who are listening on Fresh Waves Radio or on the podcast. Ask Dr. Gbemi ATP podcast. Welcome, special welcome to you all. And I'm so happy to have you here. This is Ask the Pediatrician Hour. It's a program where we discuss important topics that have to do with the health of our children. And in the last few days, we've had so many world celebrations or special days that have to do with children. And today I'm going to be discussing a topic that has to do with one of them, and that is prematurity. On the 17th of November, every year we celebrate World Prematurity Day. It's a day for creating awareness about our tiny babies known as preterm babies or premature babies. And if you want to know why it's so important for us to have such a day, for us to remember and to create awareness about prematurity, I want you to stay tuned and don't go anywhere, because that is what I'm going to be talking about today. So welcome. And if you have any questions, you remember that you can always post your questions straight onto our Facebook group, Ask the Pediatricians on Facebook, or you can send me an email, Dr. Gbemisola at askthepediatricians.com. And for those of you who are watching on Fresh Waves Radio or listening on Fresh Waves Radio or watching on Fresh Waves Facebook, you can also send your questions on their WhatsApp number. So that is, and we'll try and address this as soon as we can in subsequent episodes. So thank you so much for joining us. This program is brought to you by Ask the Pediatricians Foundation, and Ask the Pediatricians Foundation is committed to promoting the health and well-being of all children globally, and we do that through our health education platform and through free community medical outreaches to communities that have very limited access to pediatricians. And so this program is part of our work, as we try to reduce preventable deaths of children in the world, especially in Africa, where majority of these deaths happen. So thank you so much for joining us today. And so without wasting much time, we're just going to go straight into the topic of today. And as you can see, for those of you who are watching, you can see that I'm talking about prematurity. And for those of you who are listening, I'm sure you can hear me as well. So let's talk about prematurity. And the first thing I think everybody wants to know is, what is prematurity? Okay, so just to start by saying, the word prematurity can be used for not just, some people also use the word preterm baby, some people also use the word preemies, but we're all referring to the same thing. Any baby that is born before 37 completed weeks of pregnancy is said to be premature. All right. So it is so important for us to remember that 37 weeks. Normally, when mothers are pregnant, your doctors will calculate the expected date of your delivery, and that expected date is usually 40 weeks. It is based on the fact that average pregnancy should last 40 weeks. However, from 37 weeks, you can deliver your baby. So that's why doctor will tell you can deliver 2 weeks before the date, even up to 2 weeks after. So we call those periods term. So term is from 37 weeks to 42 weeks of pregnancy, and delivery around 37 to 42 weeks of pregnancy are still referred to as normal or term delivery, and they're fine. But any baby that is born before 37 weeks is can be said to have been born too early, and we tend to call them premature babies or preterm babies or preemies. And why is this so important? That's because preterm birth are one of the leading causes of death among children below the age of 5. So when we're talking about deaths of children below the age of 5, especially in sub-Saharan Africa, where majority of deaths of children below the age of 5 happen in the world, um, newborn deaths, that is babies that are dying in the first 1 year of life, constitutes 25% of that population of deaths. So you can see it's a huge population. And out of this 25% that are due to the newborns, so for example, we say we have 5 million children dying, uh, about 1 million of them will be newborn babies. And out of these ones, the preterm complication, that is, for that babies were born earlier than 37 weeks, is one of the leading causes of death. In fact, in 2015, 1 million deaths of children alone below the age of 5 were due to preterm birth. So it's a huge, huge issue. And that is why we have to have a day to create awareness about preterm babies, to create awareness about prematurity, and to more importantly, see how we can reduce this burden, to see how we can prevent our children from being born too early. And if they are born too early, to see how we can support them so that they don't end up becoming part of these statistics. So preterm birth complications is one of the leading causes of death of children under the age of 5. And so with a very huge number of deaths, even in countries where they have advanced um, health services and they're able to take care of their children, prematurity is still a major issue they also have to contend with, and it's still one of the leading causes of death, especially in those countries that are even more advanced. But for us in Africa, it's still part of all the other major issues that we are always contending with. And every year, 50 million babies are born preterm. You can imagine it's a lot. That's a huge, huge number. 50 million babies are born preterm, and this is between 8 to 15% of all babies that are born. It varies from one country to another. So in various countries, it's between 8% to 15% of babies that are born in those countries are born preterm. So we have a huge number of babies being born preterm, 50 million every year, and about 1 million of them dying. That is huge number. And so that is why it's so important for us to talk about prematurity. We don't want our babies born too early, and because of the complications that come with prematurity. And that is why we're having this discussion, because as you remember, our goal is to reduce deaths of children before the age of 5. And so when we're talking about reducing the deaths of children, we need to focus on what are the things causing the deaths of our children. And what I'm trying to say today is that prematurity is one of those leading causes of death in the entire world. And so we must know about prematurity and we must try to prevent it. And I guess the question everybody wants to know is that why have babies born premature? Why do some babies want to come out too early? Now, there are so many causes of prematurity, but the most important thing is that any issue a mom has in pregnancy, anything that make a pregnancy complicated, can lead to that pregnancy ending too early, and that is ending prematurely. So there are so many issues. So this is one of the reason we emphasize antenatal care, the need for mothers to register for antenatal care so that complications in pregnancy, whether with the mother or even with the baby in the womb, can be detected early, and we can try to do something with some of them. If we're able to do that, then maybe the pregnancy can still be kept up to 37 weeks, or if at all we can't ensure the pregnancy will end before up to 37 weeks, then at least we can see how to help the baby so that the baby, when born, even premature, can still survive. So it's so important for us to know that any issues in pregnancy can lead to issues, can lead to preterm delivery, and so it is not it is not one thing. It is not one thing that will lead to prematurity. But before I go on, that I need to quickly say that when I talk about the 1 million children, preterm babies die each year, uh, is these deaths are actually preventable. These are things that we can prevent. So 3/4 of these deaths due to prematurity can be prevented through current and cost-effective interventions. So this is why we are having this World Prematurity Day, because it's about creating awareness on how we can reduce the deaths of our preterm babies. And just remember again, 5 to 18% of babies born in each country's preterm babies, and that is a huge number. Now, there are also different categories of preterm babies. So it is not, every preterm baby is not the same. So some babies are born very preterm. Some babies are born late preterm. And I know it's difficult for some mothers to accept that their babies are preterm. For example, mothers who have the baby at 36 weeks. So it's just about a week preterm. But as far as we are concerned, as long as they are born before 37 completed weeks, they are still preterm babies. I know the 36 weeker is, they are as big sometimes, like every baby born at 37 weeks and all that. They are otherwise fine. But yes, they are still preterm babies. So obviously, our main worries are usually towards the what we call the extreme preterms. Extreme preterms are babies born before 28 weeks, 28 weeks. And if you put that in perspective, that's less than 7 months. And we've had babies survive as low as 23 weeks. I can't remember who is the youngest survivor now, whether it's 23 or 20 weeks. I know, but we've had babies survive, and we're having babies surviving below 500 grams these days due to advanced technology. But then there's still lots and complications that such babies may face in the beginning and even in the future. So we still don't want babies born too early. So we have extreme preterm babies born before 28 weeks, and we have very preterm between 28 and 32 weeks. So for some countries, I think even for Nigeria, we start seeing viability, from 28 weeks. So any baby born before 28 weeks, some countries don't actually count them, and they group them as abortion or miscarriages rather than a baby. But I think the current definition is that as long as baby has sign of life, in other words, even if baby is born at 20 weeks or any weeks whatsoever, and the baby has a sign of life, baby is crying, baby has heartbeat, then we're going to still take it as a, we're still going to give baby all the care that we can. But I know that in those days we used to say any baby born less than 28 weeks, we're not even going to bother. But these days things have changed, technology has improved. So we have the extreme preterm, less than 28 weeks, very preterm, 28 to 32 weeks, and late preterms, 32 to 37 weeks. So any baby born, late 32 weeks, most of them are, they are still preterm, even up to 36 plus 6 days, they are still preterms, but they are late preterms. So those are the various category. And when we talk about the complications of prematurity, usually more with those extreme preterms, those less than 28 weeks. And of course, you see have complications in those who are very like 20 to 32 weeks, but it's going to be as bad compared to those who are less than 28 weeks. And of course, even for our 36 weeks, they can still have challenges, but obviously it won't be as much compared. So the younger the baby, in other words, the lower the weeks at which the baby is born, the more the complications, and the smaller the baby size in terms of the weight, the more the complications. So babies that are what we call extremely low birth weight, less than 1 kilograms, they have more challenges. Maybe 50% of them will have cerebral palsy, compared to babies who are very low birth weight, which is between 1 kilos to 1.5. They also have their own challenges, but they're able to weather it better. And then compared to babies who are uh, just low birth weight, so that is between 1.5 to 2.5. So, they do much better. So we classify our preterm babies according to their gestational age. That is the weeks in which you deliver the baby, and we also classify them according to their weight. So according to their age, in terms of the gestational age when they were born, we have the extreme preterms, less than 28 weeks. We have the very preterms, 20 to 32 weeks, and we have the late preterms, 32 to 37 weeks. And in terms of the weight, we have the extremely low birth weight, which is less than 1 kilos, and we have the very low birth weight, 1 to 1.5 kilos, and we have just low birth weight, 1.5 to 2.5. And then, like I said earlier, um, any conditions that list any challenges at all in pregnancy can potentially leads to a baby being born premature. And this can be challenges with the baby or with the mother or with circumstances even external to them. For example, if a mom goes into like an accident or an injury, she can just go into preterm labor. So there are lots of risk factors for prematurity. So let's look at some of those. Who are the people at risk? Because if you know that you're at risk of having a preterm baby, then we need to monitor your pregnancy more closely. You need to be with the specialist, the obstetrician, they're getting the pediatricians involved early. We are all working together to make sure that baby can stay in the womb, because the womb is still the best um, home for a baby before 37 weeks. So baby is not ready to come to live in the outside world before 37 weeks. But if we cannot, and there's some risks to the life, then we have to bring out the baby. But we need to know, because the main challenge is that sometimes mothers don't even know they are at risk, or they don't even, then it just happened, and it can be more difficult if we don't know. But if we know, we can prepare for the baby, and we can see how to make sure that we minimize all the possible complications of that preterm birth. So, what are the risk factors for prematurity? If you have had a previous preterm delivery, yeah, this is a risk factor. I've had somebody ask us on HCP, like, why is she always having her babies so early? All her babies were preterm. So, some people are prone to having preterm babies. So, especially those who have what we call incompetent cervix. So, normally the cervix is the mouth of the womb. So, the womb It's like a bag and it has a small end, which is the cervix. And that end is supposed to be closed throughout pregnancy. So what happens during labor when the baby is ready to come out, hopefully after 37 weeks, is that that cervix will open up and the baby can come out through. So we expect that cervix to always be closed. But some women have this tendency that the cervix is not fully open, it's not fully closed, and it's somehow open. So as the baby gets bigger and bigger, it opens more and it's easier for the pregnancy to come through. So usually, obstetricians sometimes, if they know for such women, they do what we call sacklage. In other words, they suture. They tie the mouth of the womb with suture so that the baby won't be able to come out until when we are ready for the baby to come out, and then they can remove the suture and the one mother can go into delivery. So if you already have a preterm baby, it can happen again. So you need to go for antenatal care on time. And this is why mothers should not assume because I've had a baby before and everything's fine. And what else they teach us in that antenatal care? Why should I keep wondering myself? Please, you still need to go because each pregnancy is different. And if you already have a preterm baby, we may expect it to happen again and we need to monitor you very closely. Also, getting pregnant too close. This is why we've been screaming and talking about family planning. I think I'm just going to come back and talk about family planning on this platform in few weeks to come. Having some people just feel like, oh, it doesn't matter, I don't want to do family planning, I just want to have my baby so close. There are lots of risks, and one of the risks with having your babies, with not spacing your babies well enough, is preterm delivery. So the second baby is at risk of being born too early. So please space your pregnancies at least by 2 years. That's what we recommend. So have the first baby, let baby be fully weaned off breast and all that. We usually expect that around the age of 2, and at least one, so that you can start trying. So that by the time you're having your second, maybe at least there's a 2-year gap between the two pregnancies. That's what we expect. If you have your pregnancies too close, then you're likely going to be at risk of having another preterm babies. Okay, also having multiple babies. I know some people like having twins and triplets and quadruplets, especially for mothers that are going for IVF. And sometimes they do put in like 2 or 3 embryos because they are not sure whether all of them will attach. So but the challenge is that sometimes all of them attach, and there's implantation for all the babies, all the embryos in a putin, and then you have multiple gestation. Or some people genetically in your family, you are prone to having twins. I think this will live some parts of Yoruba culture. The twins is high prevalence of twin gestation. So twins pregnancy is also one of the risk factors for having babies being born preterm. And I think people even always believe in some culture that you can never have your babies up to twins pregnancy up to 9 months. That is actually not true. You can have twins pregnancy up to 9 months, but I think it's based on their own observation, which is quite correct, that twin babies or triplets tend to come out early. And I think that is understandable because there are too many people in the womb and causing a lot of pressure on the womb, and it is easier for the service to open and for them to come out. So it's not unusual for multiple gestation, as we call twins, triplets, to come out before 37 weeks. We kind of expect it because it's quite common, but that does not mean it is compulsory and they must come out by 7 months. No, it's not true. That is a myth, but it's just based on observation because of the risks of prematurity with twins gestation. But majority of women still carry their twins to term, and some still have normal weight. So it is not all the twins that will be born preterm. So don't fall for that myth. But then there's still some elements of fact in the sense that twins can be born preterm. Okay. What other issue? I've talked about having abnormal cervix or abnormal uterus. So if a mom has a some some kind of uterus that are not properly shaped. Maybe there's some reduction in the size and all that, or the cervix, like I've talked about, incompetent cervix that is always open. Such mothers are prone to having preterm babies. Also, women or young girls having their babies before the age of 16, when the whole reproductive apparatus is not fully matured. And this happens actually in Africa, in Nigeria, in parts of the country where we have what we call child brides, and children are given in marriage as early as 13. And we are already been advocating against that. It's one of the reasons why we are advocating, because number one, the reproductive apparatus are not ready to carry a baby, and such girls, if they have a baby, they're likely going to have preterm babies. They're likely going to have so many complications, and this is why we should wait for at least 18 years before we allow girls to go into marriage, or before we allow them to start having babies. Also, old first-time moms, 35. I know there was a time I took a presentation on ATP, and I talk about age childbearing age. For the medical people, childbearing age is 18 to 35. And a lot of people were very upset because we're living in a culture now that lots of women are getting married later and later, and we have people trying for their first baby at the age of 40, and they were like, why should I say that 35 is like, it's like, wow, I feel like I'm condemning that those who are 40 cannot have babies. No, that is not the point. So that is not the idea. You can always have your babies whenever you want to have your babies. But the challenge you should know from the medical perspective is that the older it takes you to have your baby, the more the complications. And one of those complications is this prematurity. And that is why when we say childbearing age is 18 to 35, we're not trying to slight older mothers, or we're not trying to make anyone feel bad, but we're just trying to say you are likely going to have more challenges the older you are when you're having your babies. So we want you to have your babies before 35 if you can. But if you're having your babies after 35, you can have your babies. That's not the issue, but be aware of the major complications that such babies can have. There are many of them, which is not what I'm going to be talking about today, but one of those complications is prematurity. All right. Okay, so also mothers that have health problems, mothers that have heart problems, kidney problems, any some mothers have cancer when they're having their babies. So all those mothers with chronic health issues, they are likely going to they are prone to having preterm babies. And this is why when a mother has health issues, they need to be registered with specialists when they are pregnant, because only the specialists that can monitor them and try to see how we can keep the baby long as possible in the womb. But sometimes we just have to bring them out early, especially if there's risk to the life of the mother who have hypertension, preeclampsia and all that. Sometimes we just have to bring out those babies, even though we know it's not yet 37 weeks, but because we are worried about the mother going into what we call eclampsia, the mother starts having convulsions, or the baby may also even die in the womb because that uterus, that womb is no longer favorable for the baby, is obstacle to the baby, so we need the baby to come out. And most of the time, once you bring out the baby, then the blood pressure starts to come down for the mother. So sometimes we just have to bring out the baby if the risk is too much, or we suspect that the blood supply to the baby, the placenta has been compromised. They just have to bring out the baby. Or a mother was open a rupture of water before the normal time, and we're worried about infection already to the baby in the womb. Sometimes you just have to bring out the baby. Other reasons that can put the baby at risk of prematurity is smoking, which is why we say mothers, please do not smoke. Smoking can also put your baby at risk of preterm delivery, or using drugs like cocaine and the rest of those kind. Please, those drugs are also risk factor to a baby being born preterm. You know, like I already mentioned, any health issues of the mother, like high blood pressure, mom having infection, mom having diabetes, mom having clotting problems, or even problem with the placenta, all these issues can lead to that pregnancy either ending by itself early, or doctors have to step in and end the pregnancy early. And of course, if a baby is also, there are some issues with the baby too in the womb. Maybe they are not properly formed, or there's some abnormalities. All those things can also lead to the baby being born premature. You can see it's a very, very long list. We have not even talked about external factors like, injuries, trauma, and all those kind of things. So these are all issues. So there is, the risk factor is so long. And the bottom line is, we have a baby being born before 37 weeks. And when that baby is born, because there are challenges babies who are born before 37 weeks are going to face. So that is why we don't want them born too early. But if they are born, then we need to be aware, we need to know what to do. So how do you know a baby who is premature? I think it's obvious. The most important thing is that they are born before 37 weeks. Now, why is this important? Because sometimes some mothers don't know their dates. They don't know when their last menstrual period is. So they are not actually sure of their dates. So sometimes they are not sure whether their baby is born preterm or not. But notwithstanding, there are ways by which we as pediatricians, we can examine a baby. And when we examine the baby, we can figure out what the age of the baby is. In other words, whether the baby was actually a preterm baby or not. Even though no matter what the mother tells us, so mother may tell us, "Oh, I'm sure I'm 40 weeks," but when you see the baby, then you can see some signs, and then you know that this baby is likely not what the age we were told is, but this baby is looking preterm. So there are physical signs that we can see in a baby that is born preterm. And of course, the first one is the fact that the babies are usually small size. So they usually weigh less than 2.5 kilos. But there are some babies that are born at term, so that can weigh less than 2.5 as well. So usually most of those ones are what we call small for gestational age babies. But it's also possible for a baby to preterm and be small for gestational age. I won't want to confuse you, but let's just stick with the fact that preterm babies tend to be small. They have thin, you can see their skin, it look thin, it's shiny, you can see all the blood right running through all their blood vessels. So because they don't have enough time to have fat. See, because the last thing that happens in pregnancy in the last few weeks is the deposition of fat. So the baby is only just getting bigger and having fat under their skin and all that. But because preterm babies are born just before that period, so they tend to have this very thin, fragile skin, very little fats. You can see all the veins, and also they tend to have very little hair on their head, but they have this very soft hair all over their body, what we call lanugo. So we can see that. So when you start seeing a baby who looks like very transparent skin, lots of blood vessels, very small baby, lots of soft hair on them, then you know that they are most likely preterm baby. And of course, they look so weak. Most of them can fit into the palm of your hand. They have this, their body is not so, when you see a full-time baby, they are very flexed, everything is, they are like that, flexed position. But preterm babies tend to be just flat out, due to no muscle tone. All the male or female genitals are very tiny. Everything is not fully developed. So they're just not fully developed. But most importantly, the pediatrician can access the baby. The baby access and score them, and we can say this is a preterm baby, or this is not a preterm baby. And remember, it also depends on how preterm they have. For the late preterm, most time they don't really look that small. They actually look almost like every other baby. But for the very late the extreme preterms or very preterms, those are the ones that tend to look like what we just described. But what is more important is not even just how they look, it is the complications of prematurity. This is what leads to that deaths of like 1 million babies in a year that I mentioned when I was talking about the facts and the figures. So we really need to know that these babies, the fact that they are born before they are ready to be born, uh, predisposes them to a lot of complications. And this is what the neonatologists or the pediatricians who take care of babies, what we call neonatologists, will be dealing with. And so the complications are complications that are immediate, and there are complications that are long term. And I will need to emphasize that because sometimes once babies are out of the neonatal intensive care or the special care baby unit, mothers always think, thank God, my preterm baby is okay, he has survived, we have gone home. And I always like to tell mother, it is not yet okay. A preterm baby still has risk on long-term complications. So we need to still monitor them. So, and I know sometimes some of us don't wonder why does pediatrician want my baby to keep coming back? And baby is fine, baby is gaining weight. I don't need to go back. Please, you still need to go back because there are still many complications that are late that the pediatricians is going to be monitoring for and dealing with. So, but if you don't go back, then we won't know. And sometimes those complications can also contribute to those deaths that we're dealing with about. So it's very, very important. All right, so now let's talk about the complications that preterm babies have. Number one is the fact that they struggle to maintain their temperature. Like I told us a few minutes ago, the babies are born before they have fat deposition. So they don't have fats, they don't have all those fats to keep them warm. Even the average baby, newborn babies struggle with body temperature, but preterm babies even much more. And this is why we put them in the incubator. So the incubator is like a artificial womb, because that is what the mother's womb is doing. You're providing that nice, warm, environment for the babies while they're in the womb, so while they are growing. So if they become out too early, we have to look for an alternative womb. So there are methods by which we use, depending on how small the baby is. One way is to put them in the incubator if they are in the neonatal intensive care unit, especially if they have other health issues. Another method we do is what we call kangaroo mother care. I'm sure most of you have seen kangaroos. The kangaroos, they usually have this pouch in front of them and they keep the baby inside those pouches when they are running up and down. So we find out that we can keep our preterm babies on their mothers or even the father or anybody who is willing to offer their body on their body, chest, and then we wrap them round, and your body temperature can keep your baby warm. So kangaroo mother care is very, and especially for those who live in Africa, sub-Saharan Africa, Nigeria, where we have very limited resources. We don't have too many neonatal intensive care units, incubators. Even when we have our incubators, sometimes there's no light. Electricity supply is a major challenge, and these babies have to be constantly kept warm. So we use a lot of the kangaroo mother care, and it's very easy, very simple technology, and it can keep our baby warm. So if you have a preterm baby, even if you are home, keep them on your skin to skin contact. Just keep them directly on your skin, no clothes, nothing, just your skin with the baby's skin, and then you now wrap them around. And usually that's the way of keeping them warm. And we also sometimes have to put them in incubator, especially if they are very sick, especially for the very small preterms. Sometimes they also have breathing problems. So some of them we need us to put them on oxygen, and some of them even have to go home with those oxygen, which can lead to what we call chronic lung disease. So sometimes they struggle to breathe. Sometimes they breathe too fast. Sometimes they don't breathe at all, and we have to tap them and remind them to breathe. This is sometimes one of the complications. We call it apnea, when they stop breathing, and then you sometimes have to tap them. Oh, come on, keep breathing, and then you'll start to breathe again. So these are some of the complications we need to watch out for. And of course, some of them also have issues with feeding. Also, for preterm babies, feeding them is still breast milk, it's still exclusive breastfeeding, even more than the term babies. If there's anybody that needs breast milk, it is a preterm baby, because if you give them formula, you can actually damage the intestine. You can you can lead to complications called necrotizing enterocolitis, which may end up, needing they may end up needing operation to remove the damaged intestine. So for preterm babies, it is still breast milk. I know a lot of mothers saying, "Oh, my preterm baby is so small. I want the baby to quickly gain weight, and so let me go and buy formula." No, ma, you're actually going to cause more harm. So it is still breast milk for them. Breast milk better. Sometimes, if we think, because for the preterm baby, their feeding is not just about volume. Sometimes they may not gain weight for other reasons. So it's not just about food here. So that is why a pediatrician has to be involved in the care. Sometimes it's because there's too much acid, and sometimes we need to add what we call bicarbonate to their food. Sometimes if you give them too much food, they can actually stop gaining weight because you're giving them too much liquid, too much fluid. And because of that, because their heart is not fully formed, it can't handle too much liquid. It will open up all the holes that are supposed to be closing, and then they're going to have heart failure, and then they don't gain weight. So preterm babies require the care of specialists. It's not something parents use your own logic and wisdom, because some things don't make sense. You think the more food I give them, the better they'll be. It's actually not the truth. They can actually get more problems because you give them too much food. So I would still talk about the management. Maybe I should just stick to complication and I'll come back to management. So they may have problem with feeding. They may have problem with the blood. They may have low blood level. Sometimes we have to give them blood, even though the blood is not much, because all the blood in their body is not much, and those of us that are pediatricians, we are sometimes vampires. We are always taking the blood for one test or the other. And so they can lose their blood so easily. And then they can have jaundice. And because they have jaundice, they are breaking down the red blood cells. So jaundice is 80% of preterm babies will have jaundice, 80%. Whereas for the normal term babies, 60%. But for preterm babies, 80%. That is 4 out of 5 children will have jaundice. So in fact, sometimes some people just put them under phototherapy straight away. There's really no point waiting. We just start what we call prophylactic phototherapy. Though it's not even advisable anymore. But we so much expect that they are going to have jaundice. And for their own jaundice, it is not waiting until they are 20, it is 20 before we treat. So it is based on the weight. So anything 10 times their weight is too much. And so you can say a 1 kilo baby having a jaundice level of 10, and we have to change the blood. But for a term baby, we'll be doing that when the baby is over, it's getting jaundice level of 20. But for a preterm baby who is weighing 1 kilo and having the jaundice level of 10, we are running to do an EBT. So they can have severe jaundice. And these are babies that already, they are very fragile. Their brain is fragile. There are a lot of blood vessels that can use it. Even you can't even just handle them. You can't shake them. You can start to cause bleeding in the brain, and that can lead to long-term damage. And sometimes you don't even need to do anything and they can bleed in the brain. So these are very serious complications. And sometimes their blood sugar control is also a major challenge. They can have problem either too low blood sugar, or they can have too high blood sugar, like diabetes level. We need to give them insulin level. So these are complications that preterm babies could have. They can have problem with their kidneys. They can have problem with feeding. I've mentioned that all. They can have problem with the brain, which is even a major challenge, especially for the extreme preterm babies, less than 28 weeks, less than 1 kilos. The major challenge we are worried in them is bleeding in the brain or brain injury, and 50% of them are going to have that. So they end up having convulsions. They may end up having cerebral palsy. Also, because they are so tiny and all that, they're also prone to infection, and that's why we don't want people touching them anyhow. We don't want people introducing germs to them. So, and these are the things your doctors, your neonatologists, pediatrician will be dealing with in the first 2-3 weeks. So most time, after we've done with all this jaundice, low blood level, anemia, low blood sugar, high blood sugar, infection, not breathing too much, needing oxygen. We deal with all those ones in the first few weeks of life, and hopefully we overcome. Sometimes we lose the battle, and sometimes some of them They just passed them, but sometimes we're able to overcome and then we're able to send them home with you. But that is still not the end. There are still long-term complications for preterm babies. And like just mentioned, one of them is neurological. We need to monitor their weight. Some of them is still struggle with weight gain and all that. So it's important that the pediatrician is monitoring them, making sure they are having enough food. They are still prone to having infections. So they are not the ones who want to be taken to the whole community to say hello to them or waiting for the whole world to come and say hello to them, because everybody's bringing their germs with them, and these babies don't have so much power to fight those infections. And of course, the main thing is that they can actually have developmental issues. They can have cerebral palsy. They can have intellectual disability. And so pediatricians will normally monitor their development. And of course, for their development, we use their corrected age and not their chronological age, but we need to monitor. So that is why you can't just say, my baby is out of the incubator, they've given my baby to me, I'm going home, and that is it. No, that is not it. Your pediatrician usually should give you follow-up appointments, and then you need to come back. So the care of a preterm baby, from what I've said already, looking at all the complications, is something a specialist has to undertake. So if you have a preterm baby who is born in a hospital without a pediatrician, you definitely need to have a pediatrician look at the baby. So some hospitals will bring a pediatrician down to see the baby, or they will refer you to the pediatrician or to the specialist. And more importantly, we want to make sure we are aware early. So some babies, if we are aware they are likely going to be born preterm, we try to give them things like give mother steroids to mature the lungs. So the maturation of the lungs is very important, so that the lungs, the baby can breathe with the lungs. So yes, we're going to have difficulty with breathing when they are out. Sometimes when they are born, we have to give them surfactant, something into the lungs, and this has to be done within the first few, hours and days of life. So it's so important that if a baby is going to be a baby, if you have all those risk factors, you should be under the care of a specialist, obstetrician, gynecologist. Your obstetrician should inform the pediatrician on time that we are suspecting a baby is going to be born preterm. It is better to transfer the baby to the pediatrician while they're in the womb, not after they are born and then they've gone around the whole world where we don't need it. We need incubator, which is what happened in Africa. And then, and the obstetrician, they have taken their own money. They just want the baby, start taking a baby to Lutz or start taking a baby to this teaching hospital. That is wrong. It's better the baby is delivered in the hospital where the baby will be cared for by the pediatrician, so that immediately the baby is out, the pediatrician is taking the baby straight away and taking care of the preterm baby. Usually we admit them to the special care unit. We will assess them depending on the severity of the prematurity, depending on the complications they have. Each of them will be dealt with, and then hopefully we're able to send the baby home after having overcome all the initial complications. And then we still need to monitor the baby throughout. So preterm babies should also have their immunization. These days, we usually say before they are 2 weeks, before they are 2 kilos, from 2 kilos, we start giving them their immunization. But these days, we find out that we can actually start immunizing them early, as long as they are not having any major health issues. We need to establish their feeding. We need to make sure that they are feeding well. And I've already told you, it's still breast milk. Usually for the feeding, we try not to overwhelm them by sucking directly. So usually we start with giving them a cup and spoon. Some we even start with like passing a tube, NG tube, because we don't want them to, because sucking is a lot of energy. And for preterm babies, what we want to do is that we want to conserve all the calories. There's all the calories that we're giving. We want to make sure that they are all the calories that we're giving, we want to make sure that they are using it to gain weight and not to burn energy. And so that is why we always make sure that we uh, let them feed with cup and spoon and not with the breast directly. So this is what we do for our preterm babies. But as they get bigger from 1.5 kilos and above, then we will try to start giving them uh, directly from the breast. So it's something the pediatricians we have to work with. So that is what we do for the preterm babies. We monitor the blood levels. If the blood levels are low, we try and make sure we give them iron supplements, folic acid, and sometimes we even have to give them blood. Usually we use the mother's blood. Sometimes we have to give them erythropoietin, which is like a hormone that is supposed to help them increase the blood level. So we try to do all this. So these are things that we do for our preterm babies. And so many other issues. We monitor their growth, we're monitoring their weight, we're monitoring their other development as well. So that is what we do for our preterm babies. Um, and then, of course, after they've discharged home, we still keep seeing them. Usually, we should monitor and follow up our preterm babies until they are about 2 years old level before we will now say, okay, obviously, all the challenges they may have with uh, prematurity, they should have overcome them. But for those who have long-term complications like cerebral palsy, like intellectual disability, then we can refer those one on to other pediatricians who will be able to take care of them. So finally, can prematurity be prevented? Yes, of course. If you look at all those risk factors we talked about when it comes to prematurity, all those risk factors we've talked about, if we work on them, then we may be able to prevent prematurity. It is not always 100%, and that is why we will continue to have premature babies no matter what. It is not 100%, but majority of the time we are able to uh, support them and we're able to prevent. So smoking, we said no smoking, no use of cocaine, and please register for antenatal care early. Let's try and keep our our girls, up to 18 before marriage so that they will have to get pregnant early and also above 35. So those are the things that we can do for our babies. And I mean for the mothers, if a mother has health issues, we need to make sure that she gets the right support. So if you have health issues and you are likely going to have a complicated pregnancy, please you need to register in the um, you need to register preferably in an hospital that has specialist obstetrician, specialist pediatrician, because these are the people that will be involved in the care of this baby. And it's better to be with them right from the beginning so that they can monitor, they can provide the appropriate support and everything before, you know, uh, uh, complications arise. If you can work with the mother, we can work with the baby, we can prevent some complications. And if at all the baby was still going to be born, is still going to be born early, at least we know that we are there, we are able to provide that right support on time. So please, you should register on time. And if you've ever had a preterm baby as well, you are still at risk of having another preterm baby. So please register with the obstetrician on time so that they can monitor and they can involve the pediatricians early. So if we deal with all those risk factors, we may be able to reduce the risks of preterm babies. But more importantly, once the baby is born preterm, we need to make sure that the baby is under the care of the pediatricians. So thank you so much for listening. And if you have any question, remember you can always post your question directly to Ask the Pediatrician Facebook group. And let's work together to reduce the incidence of preterm babies. Till I see you again next week with another wonderful topic about the care of our preterm babies. I'm Gbemisola Boyede, and I'm saying have a wonderful day. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.